39th appointment start talking about induction with Pitocin.
Right.
Pitocin conversation usually happens when you have already been admitted and you're in the delivery room.
Yep.
Yeah.
After it's slowed down.
Exactly.
Yeah.
Yes.
Okay.
But if they're talking in the clinic about let's do an induction,
Yeah.
that's going to typically be cytotec and Cervidil.
Okay.
Okay?
Molly,
Yeah.
have you noticed that moms who've had Pitocin after the labor, do they, does their uterus contract faster?
Good question.
Okay.
Perfect. Actually, I'll answer that right now. Pitocin, you are almost 100% likely to get a little teeny dose of Pitocin in through your Hemlock. Am I saying that right? Am I? Okay. Sorry.
Yeah.
What?
Saline oil, Hemlock.
Okay. Saline well is another word
Yeah.
for it? Okay. A tiny little dose of Pitocin after baby has been delivered to do a quick tightening and contracting of the uterus so that you can deliver the placenta. That is also not a big deal, but you also don't have to ask for it. They're not probably going to ask you. They don't. That's not a, can we give you this Pitocin right now? If you feel strongly about it, you can say no, but there's no real medical reason unless you don't want it going through your system, and it's a tiny dose, and it's a one-time dose. They'll give that to you to get that last little push to get the placenta out. Good question.
After the baby's born.
After baby's born. Even if you've had nothing, even if you've had perfectly natural, unmedicated birth, they will still give you that.
Without asking.
Most likely. They'll say, we're just going to give you a little dose of Pitocin right now. Baby's born. It's not to do anything except for to contract your uterus to get the placenta out, to facilitate getting the placenta out. If you don't want it, put it on your birth plan.
Okay.
And if there's a medical reason for it, then find out, but I don't think there should be. It does facilitate that process, but the process happens no matter what.
Right.
You know? I imagine there's probably some research out there that says
Makes their job easier.
it makes their job easier, it's a little faster, and maybe it reduces uterine hemorrhage afterwards.
Okay.
I don't know. That's why I would imagine they would do it.
Okay.
There must be something out there like that. You could talk to them about it, and if you feel strongly about it, just ask for it not to. And again, if you don't have that Hemlock, then they don't do it. I mean, they could give you a shot, but you're going to know about that more than you're going to know about it. So, okay. All right. Good. Okay, moving on. So we've talked about the induction techniques. We're going to talk a little bit about pain management, or a lot about pain management if we need to. And I do have a little caveat. These techniques are not necessarily always used at the end and available to you at the Yampa Valley Medical Center, but I do like to include them so that if you're talking to someone and you're like, oh yeah, I heard about that. That's cool. But most of them are getting used more and more, which I think is great. The first one is water injections. Can anyone tell me what they know about saline water injections during labor? I hope no one tells me anything. It's
Keeps
new.
you hydrated?
What's that?
Keeps you hydrated?
No. But I mean, you know, I guess in theory, but no. Monica, you gotta stay for that. No, you don't actually just go.
Okay.
Okay, Chad will just report. Okay, so as the last time I checked, the saline water injections were used by only one OB in town. Okay, I'm gonna read it all to you and you can tell me if you can guess who it is. They're effective for back labor. What happens is the doctor and the nurses at the same time put saline water, a little teeny tiny dab of it. Who's gotten a TB test in their life? Okay, about that much under your skin, right near where the back labor pain is, okay? And they do, I think, 2 shots on each side, so 4 shots total. And it stings like a bee sting, maybe a little bit more. And it goes, again, just right under your skin, it's sterile, and they do it at the same time so that you don't have to have 4 pokes, you just have 2 pokes at the same time, so total of 4. And what it does, and someone with more sciencey or medically inclined can tell me what the reason for this, is that it modifies the pain receptors in your body. So something happens with with that pain that happens with there, it releases dopamine in your brain, then your brain thinks that there is less pain, actual pain, with childbirth. So it can help you get through some of those more intense contractions during transition that are really, really painful for you. And it will help that trick the brain that, you know, that it's not so bad.
So it's like this hurts more, so therefore you're not focusing on the labor?
Yes, but it doesn't hurt more. That's the tricky part. So it tricks your brain into releasing dopamine and saying, okay, I'm gonna help with this pain, but the dopamine release actually addresses the pain from the labor. In addition to the pseudo or phantom pain that it's feeling back there after it's gone, because it actually lasts a while.
Okay.
The dopamine release, okay? I'm not great at explaining it. I've never seen it done. I've seen people come this close to getting it but it was determined through discussion with the doctor and the OB that, might not be what's needed. So, if anyone gets it done, please come back and tell me about it. And it can help with pain for 1 to 2 hours. So it can get you through that transition time or that really hard back labor time, okay? It works the same way that TENS works. Who has done physical therapy? Yeah.
OB that does that.
Is anyone gonna guess who the OB is in town who does it?
I would say Schaller.
You think Dr. Schaller?
Yeah, I don't know.
Any other guesses? Dr. Peterson does it because she brought it from her previous practice. And again, I've attended a lot of births with Dr. Peterson. This is not a reason to change the OB if you don't want to, but I've attended several births with Dr. Peterson. And I've not yet seen her actually do it. We've come close, but she determined that it would not be the significant help this person needed, and the person agreed. So.
You request it, or is it? Okay.
Yeah, for sure. It's something if you have Dr. Peterson and Dr. Schaller, and again, you don't even know who's going to be on call while you have your delivery. And you might be able to ask Dr. Schaller to do it. It's not rocket science. The other nurses can do it. I mean, that was really, not that nurses don't know, right? It's not like it's really medically involved.
Yeah.
So I just don't know if Dr. Schaller believes in it, but Dr. Peterson says good things about it. So
It would be a good question for him.
it would be a great question. Yeah.
He's gonna get all these people asking about it.
What's that?
He's gonna get all these people asking about
Yeah,
it.
I know, it's like you took Molly's class.
But there's no risks, right, with that?
No
It's just
risk
saying-
at all.
Okay.
That's why I like it, because it is the least intervention, it's the lowest physical intervention, because we'll talk about mental interventions to get you through the pain. Another question? Okay. So the same principle, if anyone's gotten physical therapy and had the TENS, the transcutaneous electrical nerve stimulation, anyone done that? Yeah, tell us about it.
It's weird, it like tingles,
Yep.
but it feels really good when you get done doing it.
Exactly, because you release some dopamine, right, in your brain. So these are electrical units that are kind of put on certain places of your body that need to be healed for physical therapy. And they send this electrical current. Same principle, messes with your brain, changes the way your brain is thinking about the pain receptors, or the pain, and the receptors are a little bit different, and it changes your reaction and response to the pain. If you have your own TENS unit or want to know someone in the PT field and want to borrow it, try it. It could be really cool. I have not yet. I had someone who took my class ages ago, and he's like, I have a TENS unit, and they didn't use it. Because I think what happens, you guys, is you get so in the moment, and it's one more thing that you think about, oh, we have that TENS unit, but really, do we want to pull it out, and we're kind of managing this, okay? But if anyone does ever use it, please come back and tell me, or email me, okay? So same thing. Morphine, okay? So I'm going through the levels of intervention. Morphine and epidural have different pros and cons. I just put morphine on here first because I take longer to talk about the epidural. So the way morphine works is it's a shot that they give you, and it is less common in our community than an epidural, but morphine is very, very common in other areas, other regions, and especially Canada and Europe, okay? I'm not sure why, it's just a regional thing. And so what morphine does, if anyone has had morphine, or any of the off-label or the other names for it, is it just takes the edge off. It makes you a little loopy, it makes you a little goopy, and it makes you not focus on the pain quite so much. The pain is still there, contractions are still happening, but it just makes you tolerate the pain for a little bit longer, a little bit better. And so it also helps you sleep or relax a little bit. So sometimes all you need is an extra hour to get through those transition contractions, and morphine can give you that extra hour of relief so that you're ready to push. Now, The problem with morphine is if you are sleeping, sometimes it doesn't take the edge off quite enough, so you're sleeping, and then in the middle of a contraction, in the middle of a contraction, you can wake up. So all of a sudden you're like in the middle of this contraction and it's at its peak and you don't know quite how to tolerate it because you haven't worked through the breathing for the buildup. So I don't know if you can tell, but I'm not a huge fan of morphine because the other reason is it crosses the placenta into the placenta, okay? So the baby gets a little dose of it, okay? Which sometimes isn't terrible for the baby either, but you do need to kind of watch and they're going to be monitoring you and make sure the baby's doing okay with that. But no, it does cross into the placenta, it makes you a little loopy, and I haven't necessarily always seen it work real well. Okay? An epidural is our main pain coping strategy that's medical in our community, and the numbers of epidurals are pretty high. Can I get a quick idea of who is planning on having an epidural? Okay, good. Anyone who's, I'm going to just wait and see what happens and see how it goes. Okay. Who feels very strongly about not getting an epidural? A couple of people left. Okay. Okay, and I think there's, you're good, somewhere in the middle. Well, you don't know, right? And that's totally normal, and that's totally fine. And I will give you some thoughts about an epidural, both pros and cons, to help you make your decision. Because out of all of these things I'm talking about, that is one of the things you get to actually make a decision on, typically, okay? So the way an epidural is administered, what